important. Yeah. So in the conditions where digestion and absorption have both occurs in the small intestine, nutrient from the small intestine they are lost in the feces, unless the substrate such as fiber or resistant starch can be fermented into the short chain fatty acid. Okay. So, and then the second major function of large intestine is actually to serve as the site for formation and also storage of the feces. Yeah. So here your GI system, the function from the stomach, from intestine, and also small intestine and large intestine, they play a big role in digestion of what we have what we eat. The digestion and also absorption and also reabsorption of nutrients and water. So apa pun masalah yang berlaku kat situ, of course it will interfere with the nutrient digestion and also absorption. Okay, so now you know about the anatomy. Kalau if you're lost somewhere here kan, just go and open back your anatomy and physiology book. Okay, now nutrition assessment for lower GI tract condition. So there's actually multiple disorder. Because you know that there's different compartment in our lower GI tract. So any disorder, it can become multiple disorder, and because of the multiple disorder, there are actually different etiologies and care. And for the nutrition assessment, each of the disorders actually they share common factors in assessment. Okay, so this is the nutrition assessment for the lower GI tract. Sama je, basically when you want to perform nutrition assessment, what we need to stress in performing nutrition assessment in this kind of patient is, of course, we look into their client history. We check whether there are any previous medical condition or surgeries. We pay close attention to details of the surgical resection. For example, dia kata dia ada surgical small intestine surgical, which part? Is it the duodenum? Is it the ileum part, or is it at the colon part? Pay attention to the resection, surgical resection detail. And then we can ask about the medication. Any prescription or any over-the-counter prescription, any laxative, fiber supplements, because this assessment is also important because it may give you indication and it may help you to determine any problems related to the lower GI problems. The socioeconomic status and also food security. Food security. Because let's say macam issues on diarrhea, etc. It can be related to the socio-economic status and food security as well. About the support system, education, and then about the food nutrition related history. We should assess whether the swallowing and also chewing ability, any use of dentures. And then the problems related to upper GI disorder, if any. Such as nausea, vomiting, constipation, diarrhea, heartburn, and then ability to feed self and ability to cook and prepare meals. This is under food nutrition related history, food allergies, ethnicities, nutrition knowledge, and for anthropometry, we look into their height, current weight history, any weight changes, is there any significant weight loss, and also the BMI. And we can also look at the biochemical data, medical tests and procedure, and we can do measurement on assessment on visceral protein assessment as well. Okay. Other assessment including inflammation assessment, hematological assessment, lipid assessment, and also lower GI specific biochemical data. This is all the nutrients that may involve, because that may relate to the lower GI disorder. Okay, so banyak lah so I'm not going details lah on each of the indicators here. Okay. So here listed the common intestinal problems. So more than 98% of all digestion and absorption, it occurs in the lower GI tract. Okay, therefore any GI symptoms may place an individual at significant risk by impairing adequate utilization of nutrients. So the common intestinal problems include intestinal gas and also flatulence. Feel macam rasa bloated kan perut tu. And then constipation. How can we define constipation? Kita tak you constipate for how many days? And then diarrhea. Steatorrhea. Whereas then fat stool. Then gastrointestinal strictures and also obstruction. Okay. So we look into one by one of these common intestinal problems. Okay. First is the intestinal gas flatulence. So awak masuk je kan So bila kita makan ataupun kita minum ke kan, so air that is swallowed, ataupun kita panggil dia as aerophagia, and other gases are produced in the GI tract by digestive process and bacteria. So intestinal gases including nitrogen, oxygen, carbon dioxide, hydrogen, and sometimes methane. So gas is passes by belching or flatus. So gas production occurs in the stomach and small intestine from bacterial fermentation of carbohydrate can result in abdominal distension and also discomfort. So when there is a lot of production of gas is either by the food that you eat that has gas production, ataupun makanan yang kita makan tu yang menyebabkan penghasilan gas yang tinggi oleh bakteria dalam perut, dalam GI tract, ataupun memang you minum banyak makan gas, banyak makan angin, sambil macam contohnya you minum air pakai straw kan, banyak sangat seduh angin, so it also can produce gas in the stomach, usually penghasilan gas ni lagi tinggi because of the fermentation of the carbohydrate and sugar lah. Okay, so lagi satu yang biasanya kalau that can lead to increased gas if you makan makanan tu kan sambil cara makan you makan kelang kabut kan, makan binge eating, it will also increase intestinal gas lah. Okay, so if the patients come to you and complain that they have intestinal gas, rasa flatulence, so this here is among the recommendation to decrease gas. Eat slowly lah. Eat slowly. Tadi saya sebutkan kalau yang makan kelang kabut tu kan will increase the gas production. So we can recommend our patient to eat slowly and chew with the mouth closed. I know that some of you kat sini kan, ni termasuk anak I lah, suka sangat tengok mukbang tu kan, makan banyak-banyak kadang mulut terbuka, emang tak faham diorang tak kembung ke perut kan, just for the sake of popularity kan, dia sanggup makan banyak-banyak macam tu but actually it can increase gas production if you eat binge eat makan dengan cepat, mulut terbuka kan, tak tutup mulut so we can recommend our patient to eat slowly and chew slowly with our mouth closed and then avoid chewing gum, avoid using straw, minum tak payah pakai straw because it will also increase gas. Avoid high fat meals, and then the positioning, upright position during and after meals, and do not remain sedentary if possible. And sometimes we suggest our patient lepas makan tu jalanlah slow kan, jangan terus baring because it will increase the gas lah. And may need to limit lactose, sugar, alcohol, and high fructose corn syrup because This kind of food is actually food for the bacteria that love that will produce the gas. Okay. Okay, so that is for gas, yeah, intestinal gas. Okay. Now we look at the constipation. Okay, so constipation is a decrease in the frequency of bowel movement. Yeah? Uh, you can say that you are constipated. Yeah, if let's say usually your bowel open once a day. Yeah, but then now you pergi travel ke, you baru balik daripada some activity ke, kan, for 3 to 4 days you langsung tak ada bowel open. Yeah, so perhaps you are constipated kan. Yeah, ataupun you presence of hard stool. Yeah, and I was training to have a bowel movement. Yeah, but however, it is difficult to interpret the complaints of constipation. Betul ke jadi constipate kan? Yeah. So Rome 3 consensus criteria, they actually provide framework for a definition. Yeah, they define the constipation to diagnose constipation. Yeah. And in May 2016, the Rome Foundation, they released the new Rome 4 criteria for diagnosing irritable bowel syndrome, or we call as IBS. Yeah. So please, I want all students to read about the Rome consensus criteria. Yeah. What is the criteria to diagnose IBS? Yeah. What is the criteria to define constipation? Yeah, dah bagi clue dah. Please read this. Okay. Okay. So what can cause constipation? Yeah. If you look this, I highlight here, the causes of constipation is lifestyle and diet, which is very much related to us lah, kita as a nutritionist, dietitian kan. First is because due to lack of fiber in the diet, and then low total calorie and also fluid intake, also can lead to constipation. You took iron and calcium supplement, lack of exercise, immobility, laxative use, postponing urge to defecate, dysmotility disorder, neurologic disease, pelvic floor disorder, chronic use of opiates, and also other GI disorder. So if you look here kat sini, so basically when we know that this is the causes, the possible causes of constipation, so our intervention is actually we intervene here. So siapa yang kita dapat tahu memang tak makan banyak fiber, so we ask them to increase fiber in their diet. Increase your fluid intake, to prevent the constipation. Okay. So nutrition therapy for constipation, we perform their nutrition assessment. We assess their fluid and beverage intake. And then dietary fiber intake, and then we also assess any bioactive substance intake, their belief and attitudes, and also misuse of meds, especially laxative medication. So kita tengoklah berapa banyak fluid dia ambil kan. Okay. And then the nutrition diagnosis, it may include inadequate fluid or fiber intake, or the GI function or undesirable food. Okay. Okay, we have looked into the nutrition assessment, nutrition diagnosis. Now let us look at the MNT. So we suggest on adequate soluble and also insoluble dietary fiber. And so we know that apa itu soluble fiber, what is the insoluble fiber? So soluble fiber, it dissolve in the water. So soluble fiber ni dia include plantain and also gums. However, insoluble fiber, it doesn't dissolve in water. Contohnya plant cellulose and also hemicellulose. And both soluble and insoluble fiber, they have their own benefit. So soluble fiber, it can help to improve digestion and lower blood sugar, while insoluble fiber, it can help to soften stool, making it easier to pass. So both is important for our GI system. So kalau soluble fiber, we can suggest to eat oat bran, barley, makan kacang, beans, lentil, some fruits and vegetables, ya. While insoluble fiber, dia boleh ambil lah wheat bran ke, vegetables, whole grain, ya. So most kind of fiber is important lah. Okay. So we can recommend intake of 14 gram per 1,000 kilocalorie ataupun fiber about 25 to 35 gram per day. Okay. So fluid we suggest at least 2,000 mils per day. Yeah. And then you can also consider probiotics and also prebiotics. Okay. Okay. So about the high fiber diet. Yeah. About the high fiber diet, what we say as high fiber diet, macam kita categorize whether the patient already follow high fiber diet or not. Yeah. So it's actually increased consumption of whole grain breads and cereal and other whole grain products to 6 to 11 servings per day. Yeah. And then consume high fiber cereal, granola and legumes as needed to bring fiber intake to 25 gram or more in women and 38 gram or more daily in men. Yeah. Then we increase the consumption of vegetables, legumes and fruits, nuts and edible seeds to 5 to 8 serving per day, and we increase the consumption of fluid to at least 2 liters or about 2 quarts a day. Yeah? So following this kind of diet, it may cause an increase in stool weight, fecal water and also gas. The amount that causes clinical symptoms varies among individuals depending on age and also presence of GI disease, any malnutrition and also resection of the gastrointestinal tract. So this guideline should be implemented slowly over a period of 1 to 2 weeks to give the GIT time to adjust and thus minimize symptoms of discomfort or gas. Yeah. So this one actually we know that, yeah, we suggest our patient, yeah, to when we suggest our patient to follow high fiber diet, we should know that, yeah, this diet it will increase, yeah, the amount of stool weight, fecal water and also gas. Yeah. So be careful when we really want to suggest our patient to follow high fiber diet because of this discomfort. Yeah. So kita slowly we adjust them to increase their fiber diet, so that our system, our GI tract, it can adjust first daripada tak terkejut tiba-tiba je ambil high fiber diet. Okay, so that's about the constipation. Okay, now regarding diarrhea. Okay, so diarrhea as a definition, it is an increase in the frequency of bowel movement or increase in water content of stool. So dia terbalik diarrhea and also constipation. Okay. So diarrhea, it can be classified into either osmotic or secretory. Yeah. So kalau osmotic is when the number of osmotically active particles in the intestine increase, so results in the increase of water efflux. So for osmotic diarrhea, it can be caused by maldigestion of nutrient, excessive intake of sorbitol or fructose, enteral feedings, and some laxative. Yeah, so that is osmotic diarrhea. While so for osmotic diarrhea ni, when the causative agent is removed, so the osmotic diarrhea will stop. Yeah? So actually for osmotic diarrhea, those who diagnosed with osmotic diarrhea, kalau dia tak makan, fasting, it can relieve this type of diarrhea. Okay? While the secretory diarrhea, it cannot be stopped by fasting. Yeah? It is because due to underlying disease that will cause the secretion. Yeah? It also result from the excessive fluid and electrolyte secretion into the intestine. Yeah? So the difference is that the underlying disease is what causes the excessive secretion, not the hyperosmolality. Yeah? So for secretory diarrhea, it can also be due to the infection, protozoa, viruses, and other infection as well. Okay? So that is the classification of diarrhea, whether it's osmotic or whether it's secretory diarrhea. Okay. Okay. diarrhea, it may also occur as side effect of medication and also antibiotic. Some medication, some antibiotics, they may increase the GI motility or altering normal flora of the colon. So malabsorptive diarrhea is when the disease process impair digestion or absorption to the point that nutrients such as fat appear in the stool or increase amount. So that is malabsorptive diarrhea. Okay. Rupanya diarrhea yang selalu sangat orang kena, yang selalu sangat orang buat alasan ABC tu, diarrhea tu it's actually they have their own classification of diarrhea. This is the medication that may cause diarrhea. It is very important for dietitian to know and to identify the medication that may cause diarrhea. Kenapa Okay, contohnya kalau kita tak tahu yang medication ni menyebabkan diarrhea, mungkin kita akan salah interpret. We may thought that our prescription, our nutrition intervention ataupun diet tu yang menyebabkan diarrhea, pada sebenarnya tidak. It's actually the medication that cause diarrhea. So we know that our intervention is, there is no problem with our intervention ataupun dia bukanlah sebab makan salah yang menyebabkan diarrhea. So that's why it's important for us to know what medication that may cause diarrhea. So in patient with GI problem ni, we have to look into the medication as well, and then we identify lah whether this medication it can cause diarrhea or not. Okay. Okay, diarrhea Clostridium difficile. This is actually a gram positive anaerobic bacterium, and the leading cause of nosocomial diarrhea in the United States. So when antibiotics are prescribed, their use actually can disturb the balance of normal flora of the colon, and this bacteria has the potential to proliferate, and this will result in injury and inflammation within the colon. Okay, so it can cause colitis, secondary diarrhea, severe dilation of the colon, peritonitis, and even death. And how can we diagnose this type of diarrhea? You can diagnose it by stool sample. And treatment with probiotics so far still inconclusive, although some may show good results with inconclusive lah. We know that there's a practitioner who believe in probiotics, but some still no, but still there is no evidence to say that, no strong evidence to say that probiotics may help. Okay, and then diarrhea that related to enteral feeding. So enteral feeding is also often implicated as a cause of diarrhea. So when the patient is on enteral feeding and then is encountered dapat diarrhea, so first is of course you must check on the medication and also on the treatment, whether the medication and treatment yang menyebabkan diarrhea. However, enteral feeding is often related with diarrhea, so what we should do is perhaps we need to change the types of formula. Formula ni dia tak kena je diarrhea, so we change the formula, ataupun kita tengok dia punya strength, rate of feeding. We can reduce the rate of feeding is often proposed. Although it's still limited evidence, but I believe that the limited evidence because of limited study being done. So this is our practice lah when we say that the patient is on enteral feeding diarrhea. After we do nutrition assessment, we identify what caused the diarrhea. If the cause of the diarrhea is due to the enteral feeding, so this is what we should do. Either we change the type of formula or we revise again the feeding part, the feeding rate. Okay. So what is the recommendation to prevent diarrhea generally for community ataupun for general patient? We improve the access to clean water and safe sanitation. We know that this is related to clean water, is really related to our GI system. We promoting hygiene education. Cara jaga kebersihan tangan, nak makan kena bersih. Lepas Tak kisahlah lepas buat kerja ke ya, selalu orang says kalau nak makan mandi dulu, bersihkan badan ya. And then for baby, we promote on exclusive breastfeeding direct from the breast, breastfeed, because when bila kalau minum bottle feeding ke, sometimes the bottle is not clean properly, dekat botol susu tu masih ada kotor-kotor kan, and then improving weaning practice when they want to introduce weaning, how macam mana introduce dengan makanan yang boleh dimakan oleh baby lah with soft diet first, and then immunization of all children is also the recommendation to prevent diarrhea, keeping food and water clean, and then washing your hands with soap before touching food, and also sanitary disposal of stool. This is the general recommendation lah. But how about the nutrition therapy? So when there is a fluid losses due to diarrhea, it will lead to dehydration, hyponatremia, and also hypokalemia. If the case is severe, it may lead to the metabolic acidosis, malnutrition, and infants and elderly are at greatest risk of malnutrition and semua isu ni lah. So this is a nutrition assessment. What you should assess, we should assess on the fluid and beverage intake, energy and mineral intake, the medication or complementary alternative medicine, the water ability and all of this. And this is among the common nutrition diagnoses. Inadequate energy intake, inadequate oral intake, inadequate fluid intake, altered GI function, and also involuntary weight loss. So the medical nutrition therapy, first is we must identify and treat the underlying problems. We first identify and we treat that. And then we replace fluid and electrolytes, oral glucose electrolyte solution with potassium, soups and broths, vegetable juices and other isotonic liquid. So it's very important for those with diarrhea, severe diarrhea, then the dehydration, and we must first replace their fluid. Ask them to drink water, ataupun kalau tak minum water dalam bentuk sup ke, isotonic liquid, and then introduce starchy carbohydrate, low fat meal and small amount of vegetables and fruit, followed by lipid. So high fat food tu later lah baru kita bagi. Because of and then we avoid the sugar, alcohol, lactose and also fructose. And prebiotics and probiotics can be considered lah for patient with diarrhea. So those patient with diarrhea, actually the nutrition consequences, they are dependent on the volume of GI losses and also on the length of the disease course. So we don't want the large volume of GI losses because it can lead to dehydration and also electrolyte and acid-base imbalance. So we first identify and then we treat the underlying problems. So meal planning tips. We limit the foods and beverages that contain sugar, lactose, fructose, high fructose corn syrup and also sorbitol. So person with lactose intolerance, drinking milk product may aggravate diarrhea. So we can suggest on lactose-free product. So itu pun penting juga lah, we identify whether our patient have lactose intolerance or not. We avoid yogurt. Avoid beverages with caffeine. We suggest on eating small snack every 3 to 4 hours. If any food that makes diarrhea worse, we just stop eating that food and we can try again when the diarrhea stops. Then avoid spicy food. If it can make the diarrhea worse, we limit the fat intake and drink more water to replace fluid loss. So that is about diarrhea. Nampak macam simple kan diarrhea, cerit-merit. Jumpa doktor, minum ORS cukup tapi kalau orang normal macam you all kan, tak ada apa-apa underlying issue kan, mungkin diarrhea sesekali itu bukan perkara yang menakutkan lah, but for some people they have severe diarrhea, vomiting and then other issues that we afraid that will jeopardize their health. So if you encounter patient with diarrhea, please treat them accordingly lah. This is all the meal planning tips, and then we already discussed about recommendation this month. Okay. Self-study is about prebiotics and probiotics. Please study by yourself what is prebiotics and what is a probiotics, and relate it with our GI system. Okay, kita dah tengok tadi constipation. We also have to look at the diarrhea. Okay, and let us see about the malabsorption. So the various possible causes can cause malabsorption. We define malabsorption as maldigestion of fat, either carbohydrate or protein. So it can be caused by inadequate digestion. Kenapa inadequate digestion? Contohnya sebab ada insufficiency of enzyme ataupun certain drugs, bacterial overgrowth in small intestine, ada inflammation, genetic disorder, defect in the mucosal, any endocrine and metabolic disorder. This can cause malabsorption. Okay, so the etiology of malabsorption is when there is a decreased villus height, enzyme production or dysfunction of accessory organs due to disease. And perhaps there is a decreased transit time. This is due to surgery. Okay. Pathophysiology of malabsorption. Kita tengok kalau kita tengok start daripada fat malabsorption. Steatoria, which is the fatty stool. The fat travels undigested and unabsorbed to large intestine. When there is fat malabsorption, so your fat soluble vitamins is malabsorbed. Okay. The symptoms include abdominal pain, cramping, and also diarrhea. So for diagnosis, DX is a fecal fat test, or the D-xylose absorption test, or small bowel X-ray. So that is for fat malabsorption. Usually kita dapat tengok orang tu ada fat malabsorption and there is ada steatoria lah, and presence of symptom juga lah. Okay. And then carbohydrate malabsorption, usually it is lactose malabsorption. So the symptoms include decreased gas, abdominal cramping, and also diarrhea. So we test include the lactose tolerance test, lactose breast hydrogen test. So those with carbohydrate malabsorption, we restrict milk and dairy product, and products such as lactose can be recommended. Okay. And about the protein malabsorption, is protein losing enteropathy. So it will reduce the serum protein, and those with protein malabsorption, they may present with peripheral edema. Okay. So that is just about the type of malabsorption and what's the symptom. So we dapat patient yang ada malabsorption, so we perform the nutrition assessment. So benda yang paling penting bila tengok malabsorption, kita tengok adakah any changes in weight, any weight loss, and we check on the vitamin and mineral deficiency, and also is there any presence of any chronic protein energy malnutrition. So ni bila case malabsorption ni, mari kita tengok weight loss lah, is the indicator yang senang nak tengok lah. Lepas tu baru check lah dia punya biocap data dia, apa deficiency yang ada. So the nutrition diagnosis, common nutrition diagnosis, it may include malnutrition, alter GI function, and also impact nutrient utilization and underweight. This show you the fat restricted nutrition therapy. So those yang ada fat problem, fat malabsorption problem, they may need to follow the fat restricted nutrition therapy. Yeah, so basically just like not recommend food that is high fat food lah, ya, macam high fat bakery, ya, fried food, goreng pisang contohnya kan, fruit served with butter or cream, ya, semua kat sini lah, ya, we don't recommend this to them. Okay. And then those under lactose control nutrition therapy, yeah. So this is the food group that we recommend, yeah. And boleh tengok kat sini nanti apa apa our recommended food and unrecommended food. Okay. Okay. Kita just ada 2 table saja, ya. That is for malabsorption. Okay. Now we look into the strictures and also obstruction. Yeah. So for GI surgeries, yeah, IBD, intestinal bowel disease, peptic ulcer, radiation enteritis, yeah. So the obstruction here, it may be partial or complete resection, complete obstruction. Yeah. So it is believed that fibrous food contribute, although there are no control study. Okay. So other type of disease including celiac disease or gluten sensitive enteropathy. Yeah. So this is actually due to immunological reaction to gluten. Yeah. So the definition is damage to the intestinal mucosa from gluten exposure and also genetic and autoimmune. So basically those with celiac disease, they have adverse reaction to gluten and also gliding functions, gliding fraction. Yeah. So recall back lah apa itu gluten, ya. So bila gluten tu ada dalam tepung, ya, dekat barley, ya, malt, ya. So for celiac disease patient, exposure to gliding component of gluten, it will result in inflammatory response. Okay. So orang yang ada gluten sensitive ni, celiac disease je tak boleh makan gluten, ya. So those patient, they are at higher risk of lymphoma and osteoporosis, as well as the complication of nutrient deficiency and also malnutrition. Okay. This is the picture showing you about those patients, yeah, about the normal human duodenal mucosa, and this is for those with yang ada celiac disease, ya. So kat sini tengok, ya, villus height dia tinggi kan. Kat sini pula yang ini dia punya villus height is reduced, dan dia lebih flattened in appearance. Okay, so this is untuk dalam duodenal mucosa orang yang ada celiac disease. Okay. So about the pathophysiology and care management algorithm, about the intolerance of gluten, you can refer back to your textbooks, ya. Apa kat sini lah, ya. About the intolerance of gluten is due to genetic predisposition, environmental trigger, ya, immune component, and also exposure to gluten, ya. Apa manifestation here, and this is the medical management and also nutrition management. Okay, so for celiac disease, patient with celiac disease, they may need to omit sources of gluten, which include wheat, rye, and barley. So gluten does require a lifelong restriction. So celiac disease patient, they will need to avoid all foods and other products that contain sources of gluten. Yeah. So level reading is critical. Yeah, we need to identify, the patient need to identify hidden sources of gluten, and you should be knowledgeable lah about the food, yeah, yang contain gluten. So you can just balik ni, student boleh make a list of gluten-free diet. Tak tahulah apa benda gluten-free diet, because celiac disease, they cannot consume gluten. So for oats, yeah, oats are questionable. Yeah, it may it is questionable whether it can be consumed by patient with celiac disease or not. Yeah, and then you must also consider cross contamination. Yeah, that this kind of food, it perhaps doesn't have any gluten, tapi ada cross contamination when you store it, perhaps in the refrigerator ke dalam bekas ke, ya. Consider cross-contamination, ya. And specialty products, ya, contohnya memang ada develop of cookies, free gluten cookies, ya, free gluten cake, ya. So that is specialty products lah, ya. So that we can consider to patient with celiac disease. Okay. Next is tropical sprue. The cause is unknown. It imitates celiac disease. So this tropical sprue result in atrophy and inflammation of villus. The symptoms include diarrhea, abdominal distension, and this is the treatment lah. Broad spectrum antibiotics, fluid and electrolytes, folate, and also intramuscular vitamin B12. Okay, so dulu I ingat lah last time ada Sudan ni lah. So doktor, kalau tropical patient yang ada tropical sprue, yang ada disease, apa lagi yang kita boleh buat, yang kita boleh manage, ya? So my answer is actually you can look into the symptoms of the patient with tropical sprue. You are not going to manage their tropical sprue or celiac disease. You just need to manage their macam kalau celiac disease ni, you should consult lah apa yang dia boleh makan, apa yang tak boleh makan lah, ya, what type of foods that contain gluten. Tapi kalau let's say this patient like this, we can manage their symptoms. We back to their symptoms. For diarrhea, what can we do to tackle diarrhea? If the patient have anorexia, macam mana kita nak tackle anorexia dia, ya? Macam mana kita nak suruh dia makan dense food, semua tu, ya? And abdominal distension, we identify what cause abdominal distension and then we try to treat it. Okay. Then is intestinal brush border enzyme deficiency. So this is actually lactose intolerance, ya. So siapa yang boleh kena lactose intolerance? The deficiency of sugar, enzyme, and also lactase, ya. And it is common among African American, Asians, and also South Americans, ya. And it's secondary to infection, inflammatory disorder, HIV, or malnutrition. How to diagnose this? It's actually based on the history, lactose intolerance test, or breast hydrogen test. Okay. So those are the lactose intolerance. The treatment include we avoid large amount of lactose based on the individual tolerance. Yeah. Okay. Okay. Inflammatory bowel disease. Okay. Inflammatory bowel disease is autoimmune chronic inflammatory condition of the GI tract. Yeah, so it is also the general term of either Crohn's disease or ulcerative colitis. Yeah? Inflammatory bowel disease, IBD. Yeah? So the etiology is actually the interaction of both environmental and clinical factors that cause an inappropriate immune response in genetically predisposed individual. Yeah? So either Crohn's disease or ulcerative colitis, both can cause diarrhea, fever, weight loss, anemia, food intolerances, malnutrition, growth failure, yeah, and other manifestation. Okay, and it is also associated with malignancy. Okay, so for the Crohn's disease, it may involve any part of the GIT. Yeah? And for ulcerative colitis, it is a mucosal disease of the large intestine, which include the rectum. So what is IBD? IBD, we got to your tengok, ya. This is just referring to the textbook, ya. This, yeah. So the exact etiology of IBD is unknown, but it involves the interaction of both environmental and also clinical factors that can cause an inappropriate immune response. Yeah. So for those with IBD, we need a comprehensive nutrition assessment. Yeah? So this is among the common nutrition diagnosis. Okay? So those with Crohn's disease, this is a common nutrient deficiencies that's seen with Crohn's disease. Yeah? So in calorie, they may have insufficient intake, anorexia, increased energy requirements, and also fear of abdominal pain and diarrhea after eating. Okay. They may have protein deficiency. Yeah. So increase their, this is due to increased protein need, yes, so they couldn't meet the protein requirement, yeah, catabolism or healing from surgery. So this kind of catabolism, yeah, healing also require increased protein need lah, okay. And then iron, yeah, iron deficiency, this is due to blood loss and also malabsorption, yeah. Magnesium and zinc deficiency, and this is due to intestinal losses, especially from short bowel syndrome or high volume diarrhea. Okay, ada lagi rasanya, okay, ada. So calcium and vitamin D, yeah, due to long-term steroids and decreased intake of dairy food as a result of lactose restricted diet. Yeah, B12 deficiency because of the surgical resection of the stomach. Folate deficiency due to the medication. Water-soluble vitamin deficiency due to the surgical resection, so loss of terminal ileum, and also fat-soluble vitamin deficiency, yeah, because of the steatorrhea. Yeah. Jadi those yang ada IBD, yang ada Crohn disease, yeah, they may have problem kat sini lah, yeah, ada nutrient deficiency that is common among them. Yeah. So what is the medical nutrition therapy? Yeah. So it is individualized nutrition therapy, yeah. So nutrition support with parenteral or enteral nutrition preferred over the parenteral. Yeah. We need to assess their energy needs, yeah. We assess their stress factor, yeah. So orang yang ada IBD ni, they may need to increase protein needs, yeah. And we suggest on small and frequent meal, yeah, on the low residue and also lactose free diet, yeah? And of course we need to assess for micronutrient deficiency as well, yeah. So kalau memang ada micronutrient deficiency, yeah, for we may require supplement lah, especially for vitamin folate, vitamin B6 and also vitamin B12. Okay, so just remember lah, for IBD, yeah, usually they are on nutrition support, and we prefer enteral nutrition over the parenteral nutrition. Okay, so that is IBD. Yeah. And what is IBS? Yeah, ada juga IBS, which is the irritable bowel syndrome. Yeah. So kalau IBS, it is actually abdominal pain or discomfort that occurs in association with altered bowel habits over a period of at least 3 months. Yeah. So common syndrome involving abdominal discomfort and altered intestinal motility, bloating, feelings of incomplete evacuation, mucus in stool, straining or increased urgency, GI distress with psychosocial distress. Yeah. So ni kita tengok IBD, now we look into the IBS, yeah, irritable bowel syndrome, yeah. So jangan confuse, yeah, IBD, IBS, yeah. If IBD, it's actually autoimmune, yeah, autoimmune chronic inflammatory condition. Ya, sekali ingat IBD dia mungkin dia adalah either Crohn disease ataupun ulcerative colitis. However, IBS it is syndrome, abdominal pain ataupun discomfort, yeah, for at least 3 months. So we diagnose as IBS. Okay. Okay. This is the potential etiological factors in IBS. Yeah. So for the clinical manifestation, they may present with abdominal pain, alteration in bowel habits, and also gas and flatulence. Yeah. Okay. Yeah. So for the nutrition intervention, it depends on the symptoms and food trigger. Yeah. What the symptoms present? They present dengan gas dan flatulence ke? So we treat on that. We intervene on that. Yeah. Kalau dia tunjukkan symptoms of ada gas and flatulence, so we treat that. Abdominal pain, so we treat on the abdominal pain. Yeah. So exclusion diet. Yeah. So what food that triggers IBS, so we should exclude it. Yeah. And there is a FODMAP. the FODMAP ni singkatan for fermentable oligo, dye and monosaccharide and polyols approach. So foods high in FODMAP are not well digested and their osmotic load contributes to luminal distension. So kita tengok apa itu FODMAP. So we also like to relieve the symptoms associated with gas and flatulence. Remember tadi earlier kita ada cerita pasal macam mana nak reduce gas. We ensure adequate nutrient intake, tailor diet for specific pattern of IBS, management of symptoms, and also inadequate diet and prebiotics if necessary. Okay. So FODMAP, ni tadi saya pasal FODMAP lah So it's actually foods that containing the fermentable oligo, dye and monosaccharide and polyols. This food, they are not easily digested and absorbed. So they can cause pain, nausea, bloating and fullness. So it claims here a low FODMAP diet may help people with GI problems like bloating, gas or irritable bowel syndrome. So this kind of food that need to be avoided lah. So we avoid lactose, we avoid excess fructose, fructans, galactans and also polyols. And this is the kind of food that we can enjoy lah. Actually FODMAP diet ni it's also not only benefit those with people with GI problem lah. You all pun tak ikut pun okay juga, lagi selesa perut lah. Okay. This is gas producing food. Vegetables, beans, grain, cereal. So paling kerap kita tahu lah this kind of food it produce gas gas producing lah. Beet, broccoli, semuanya, cauliflower bukan je dalam makanan tu ada gas tapi bila kita makan the bacteria it will produce a lot of gas lah when we consume this kind of food. So that's why ada orang dia cukup bakteria tu, ada yang tak cukup kan, dia terlebih so sebab tu dia berbeza-beza. Ada orang bila dia makan brokoli dia rasa okey je, dia tak ada banyak gas tapi ada setengah orang akan produce a lot of gas. Okay. Step to decrease gas production. Sama juga macam yang tadi saya cakap lah. So when eating tips, we cut back on fried and higher fat foods. We eat smaller meals throughout the day. Avoid eating while anxious, upset or on the run, and avoid carbonated beverages. And for personal habits, we increase the physical activity for a minimum of 30 minutes a daily. And then medication, certain medication that may ease the cramping and also abdominal pain. Okay. Okay. Next, we move to the diverticular disease. So diverticular disease is the herniation of the colon, chronic diverticulosis, and also acute diverticulitis. So it is due to inflammation, visceral hypersensitivity, microbiome changes, and also abdominal motility. And historically associated with low fiber intake, history of constipation, and also increase of chronic pressure. So the risk factors include those with obesity, decreased physical activity, steroids, alcohol and caffeine intake, and also cigarette smoking. So for diverticulosis patient, we suggest on high fiber diet and we should increase it gradually. We suggest on supplements if necessary and adequate fluid intake. Okay. Other diseases including intestinal polyps and also colon cancer. So colorectal cancer is the third most common cancer among US adults. And polyps are considered as precursor of colon cancer. So those with colon cancer, of course, we need to follow advantage for cancer lah pula kan. So for polyps We recommend the sufficient exercise, weight maintenance or reduction if the patient is obese, modest and balanced intake of lipids, adequate micronutrients, and also limited alcohol. Okay. I hope that you are still with me. Kita dah tak banyak lagi rasanya. Okay. So I just go through common disease that involve your lower GI tapi kita tak go through details sangat pun. Okay. Ada short bowel syndrome. Tadi ada IBS, ni SBS pula. Short bowel syndrome is actually the large resection of the small intestine. So this SBL, it result from the surgical resection, congenital defect or disease associated loss of absorption. It is characterized by the inability to maintain protein, energy, fluid, electrolyte or micronutrient balances. So loss of 70% to 75% of the small bowel usually will result in SBS. So 100 to 120 cm of small bowel without a colon or 50 cm of small bowel with the colon intact. So kalau less than 100 cm of the small intestine is left, so malabsorption is inevitable. So tengoklah berapa banyak resection tu lah. Kalau dah lebih 70% memang dia akan result in short bowel syndrome lah. Okay. So silent symptoms and severity of the metabolic consequences are dependent on the presence of the ileocecal valve and of the colon. So when there is an SBS, it will cause weight loss, diarrhea, decreased transit time, malabsorption, dehydration, loss of electrolytes, and even hypokalemia. Okay. Okay, so orang yang ada SBS they may have complication. So the fat malabsorption is a frequent. For example, presence with steatorrhea, saponify calcium, zinc and magnesium. And remove ileum can lose vitamin B12 and bile salt absorption. So basically bila ada SBS memang akan ada malabsorption. Okay. So factors affecting the severity of malabsorption, number of complication and dependence on parenteral nutrition, including this list lah. Okay. Okay. So what is the nutritional care for those with short bowel syndrome? The step one usually is parenteral only for most of the patient. Maksudnya after surgery, immediately post-operative, patient will receive parenteral nutrition. Okay, and then step 2, barulah gradually introduce enteral nutrition, and we need to start early. As soon as the patient can tolerate enteral nutrition, so we start the enteral nutrition. So glutamine, nucleotides, short chain fatty acids are important nutrients for the gut that we can introduce. And narcotic drugs for pain cause GI problems and should be evaluated. So that's why you also needs to evaluate, assess the medication lah, whether it can cause, whether it contribute to the symptoms of GI or not. So SBS start with parenteral and then change to enteral nutrition. So for the nutrition monitoring and evaluation, patient will meet goal rate to meet 95% of estimated energy and protein needs within 48 hours. That is our target, and we should evaluate laboratory index per parenteral nutrition protocol. So nutritional care for SBS ni macam kita manage those with enteral parenteral nutrition lah. Okay. Eventually, the remaining bowel increase its absorptive surface and problems decrease, and adaptation can take up to 1 year. And our nutrition support is designed to meet each patient's need. Some people may need to undergo intestinal transplant. So when there is transplant, so the management is referring to transplant MMT pula lah. Okay. Generally, Yeah, we suggest low fat and high carbohydrate diet for those with colonic segment, higher fat, lower carbohydrate diet for jejunostomies and shorter ileostomies. We ask the patient to chew foods well, avoid concentrated sweets and liquid, eat smaller meals more often, up to 6 to 8 times per day, limit fluids with meal, drink isotonic beverages, and separate solids and liquid at meals as much as possible. This is actually just a general guideline. It's not refer much to the patient condition lah, whether it's sesuai tak nak guna guideline or not. Okay. Blind loop syndrome, is actually the bacterial overgrowth from stasis in the intestine, obstruction, radiation enteritis, fistula, or surgical repair. So when there is blind loop syndrome, our treatment including antibiotics, we can also consider prebiotics and probiotics. We limit the refined carbohydrate and emphasize on whole grain, vegetable, oligosaccharide, and we may use MCT to meet the energy needs, and also because of the steatorrhea kan kita may use the MCT lah. Okay, tadi tengok blind loop, I think it should be fistula. Okay, fistula. So fistula is the abnormal opening between organ. It can be caused by birth defect, trauma, inflammatory disease, or malignant disease. So the treatment include to restore fluid and electrolyte balance. So parenteral nutrition may be necessary, depends on the location of the fistula, and enteral nutrition may be possible using pre-digested formulas. So usually when patient refer to us due to fistula, we are going to provide them with either with enteral nutrition lah. So that's when the patient being referred to us. Okay. Next is ileostomy or colostomy here, which is the surgical opening of intestine to outside. It can be caused by ulcerative colitis, Crohn's disease, colon cancer, or trauma. So this is all the treatment. So the nutrition needs vary with location and individual. So we avoid gas and odor forming foods. We consider we assess on the fluids and and vitamin B12 if loss of terminal ileum. Okay. So you know apa itu colostomy. Okay. Banyaknya. Habis. Okay. So tadi you may feel overwhelmed, banyak sangat nama disease but yes, there's a lot of disease that is related to our lower GIT. But don't worry, if you just look back, baca balik betul-betul about the disease, their etiology, maybe it might be different from each other. Tapi for us, we need to understand lah apa etiology of the disease and the pathophysiology of the disease. We understand that, and then we always manage the symptom, because management of the symptoms from the GIT is almost the same. Adalah sikit-sikit different, tapi kebanyakannya lebih kurang how to manage that. We just refer to the symptom, and then we look at our nutrition assessment, our nutrition diagnosis, and we manage that. Okay. So the focal point is the GIT has the largest surface area of any tissue, which is 70% of the body's immune cell. It contains more bacteria than somatic cells in the body and has the greatest exposure to elements of the environment. So the functions of the GIT in preventing inappropriate interaction between environment, primarily foods, beverages, contaminants, and endogenous ingested microbes, known as the gut barrier, plays a primary role in health maintenance. So the new medical and nutritional approaches are being evaluated to improve gut barrier function and tolerance between the GI luminal environment and host tissue and treat lower intestine disease. Okay, so this is just a focal point. So my point is, what what you should do is first tadi I minta student untuk baca pasal FODMAP diet and then read about the prebiotics and probiotics, because even though that prebiotics and probiotics is not a new approach, but there is still limited evidence to conclude that should we give prebiotics or probiotics, although I know that most of the hospital nowadays they started giving probiotics pun tapi ada juga yang masih tak beri lagi kan. So read about the prebiotics and probiotics and how can it relate with GI disorder, and for you to really understand about the management of the symptoms. Sebab tu tadi in this lecture I highlight more on the how to manage, what is the nutrition therapy for the symptoms. Bukan setiap disease tu kita just understand what is the disease about. Tapi nutrition management is much more related to the symptoms and also underlying disease as well. Okay. Okay, so that's all. Okay, I know that very fast lah kita buat hari ni. Aku tak sangka seawal ni habis. Okay, ada apa-apa soalan tak? Semua. Okay.
Doktor nak tanya?
Okay, Stetoria ni check ni. Dia kata lah. Okay, Stetoria macam lagi teruk dari diarrhea. Stetoria is not diarrhea. Diarrhea tu is dalam bahasa mudahnya cerit-berit lah kan. Tapi kalau Stetoria tu is fatty stool. Maksudnya you buang air, ada fat, ada lemak, lapisan lemak. Dalam bahasa lainnya kita tengok you punya najis, dia terapung-rapung, ada lapisan lemak kat situ. So that is Stetoria. Dia tak sama Diarrhea is you buang air besar, kerap and you keluarkan banyak air, watery kan, adalah type dia kan. That is diarrhea Tapi kalau Stetoria tu najis you ada lemak, maksudnya ada fat malabsorption. So that is Stetoria. Okay, so SBS is caused by small intestine by resection. Kenapa ada orang perlukan that surgery? Is due to the disease lah dia ada problem dengan dia punya small intestine some problems disease lah involving that, so they require resection lah so sebab tu so it is, so that's why it's SBS lah. Certain people they require surgery on that. Okay Ashraf. Katanya hidung okay. Indonesia has problem that diarrhea is still high in children, causing deaths. Does Malaysia also have the same problem? Okay. The problem of diarrhea in Malaysia, I'm not really sure about the prevalence of diarrhea lah Memang ada case diarrhea in Malaysia that causing that, but I don't think that it's really high. The cases in Malaysia for diarrhea in children is not that high. I believe that this is because that we already try to reduce solve the root of the problem. I'm not sure about Indonesia what caused diarrhea, but we know that generally diarrhea is caused by poor hygiene kan, poor hygiene, and so the sanitation and access to clean water I think in Malaysia the case is not that high, although they have the case. The cases is there, but it's not that high. Heart problems usually occur in Malaysia childhood that cause a high risk of death. Is it related to medical condition? There's a lot of multiple problems lah, multiple issues that can lead to childhood death. Kalau related to disease tu ada macam-macam lah, tapi kalau if we want to relate to nutrition, diarrhea can be one of the factors, although it's not, the prevalence is not that high. Malnutrition, yes, it can be due to the underlying disease and also chronic diseases. Malaysian government, I think it can be related to kalau pasal diarrhea lah. Malaysian, I believe that they try to improve the sanitation, access to clean water is now better. But of course in certain place there is a problems in access to clean water as well. But somehow people dekat area yang poor access to clean water, they are more kebal sikit badannya. And then I think government has improved on the access to clean water. And in school, yes, there is a policy that been introduced by the Malaysian government, for the school policy, for the canteen policy, for them to provide healthy food. There are nurse, nurse yang kita namakan sebagai I tak ingat apa nama dia, ada nurse and juga nutritionist actually put in school, in every school in selected in district, ada few school in each district. It will be covered by at least one nutritionist and nurse to assess the sanitation, the food, in the canteen, in the premise outside of the school. There is a policy that introduced by Malaysian government lah. It's many years ago lah, a few years back lah kita dah buat. But I'm not really sure about the implementation. But yes, there's a policy to handle it. Okay. So then, Ashraf done. Adiba. Bad effects or consequences if someone doesn't chew the foods properly before swallowing it. Bila kita makan, maksudnya dia terus telan lah. Our body kan diciptakan ni sangat hebat, sangat unik tau. Walaupun dia tak kunyah betul, but dalam badan kita, when you go to the stomach, dia ada enzim yang akan proses benda tu. Dia akan break down the food, menjadi itulah dia akan break down the food. And then tapi kalau dia terus makan, dia terus tak kunyah, so proses tu akan jadi lambat lah. Dia akan akan jadi lambat. So your enzyme, your digestive process, it need to work harder untuk digest you punya makanan. So itulah masalah dia. Kalau dia sesekali dia buat macam tu, tak kerap, mungkin okey lah, tapi lama-kelamaan bila dia sentiasa tak makan, so it may affect your digestive system, your lining of your mucosa tu, sebabnya dia terpaksa bekerja lebih keras daripada yang sepatutnya. So that's why we want kalau makan tu kunyahlah betul-betul, jadi kita bantulah badan kita supaya bekerja dengan lebih efektif. So kalau you makan terus telan je, penatlah badan nak kerja. Tapi kalau you punya sistem badan tu bagus, mungkin tak ada masalah. Tapi kalau ada orang yang ada isu ke, ada defect sana sini kan, so that can be a problem to them. Okay. Apa ni? Amiza, kidney failure, constipation. Okay. Those yang ada kidney failure, ada constipation, yang ni kita kena tengok individualize. You need to do nutrition assessment. I cannot say that those with constipation for kidney failure, you need to increase water intake, because somehow it may not be suitable for them sebab mereka ada kidney failure. So do assessment to them. Adakah dia kidney failure tahap berapa? Dia sesuai tak minum air lebih? Kalau dia boleh minum air, suruh dia minum air. Suruh dia ambil fiber lebih. Ataupun tengok dia boleh tak nak makan dia boleh tak buat aktiviti lebih sikit, berjalan lepas makan, to avoid that constipation. Tengok balik dia tahap mana. Kalau dia boleh minum air, suruh dia minum air lah. So kalau yang ada disease macam ni, I tak boleh nak cakap terus lah. Kita kena buat assessment. Generally dia ada constipation, ask them to increase their water intake if they can increase their water intake, if dia boleh minum air lebih, and then take high fiber, and then increase activity. Okay, kena mobilize lah. Okay. One of the causes of constipation is laxative use. Laxative is also treatment for constipation. Okay, yang ini dia dua-dua boleh menyebabkan constipation and boleh menyebabkan
treatment.
Mana ngajar misalnya, one of the causes of constipation is laxative use. However, laxative is also used as treatment of constipation. This depends on the patient. The patient dia tak boleh ambil laxative, dia akan menyebabkan constipation. This is just part of the medical management lah. Dia tengok adakah dia, kadang orang tu dia tak makan apa-apa tau, so dia dapat laxative, dia lagi tak boleh nak membuang, nak bowel open, so this is actually part of medical management lah. So we just look lah, either dia take laxative, and then dia constipate, so perhaps that medication is not suitable for them. Okay. Ini apa soalan ni, oats for celiac disease ya. Okay. So for celiac disease ni, kenapa kita kata oats is questionable? Because oats ni dia kita kena tengok oats yang memang ada label gluten free. So because oats ni, there are study that say that people with celiac disease, dia akan ada akan trigger dia punya intolerance, dia punya ni. So dia tak boleh mereka ada intolerance kepada oats, sebabnya ada study yang menyatakan orang celiac disease, they can consume oats freely, but there's also study that suggests that oat they can trigger celiac disease. So those with celiac disease, they cannot eat oats, so that's why kita kata oats this is questionable. Some people with celiac disease, they can consume, they can tolerate well with oats, but some are not, so as suggestion, kita bukan kata dia boleh makan ataupun tidak. We should ask them whether if they eat oat, is it will trigger dia punya immune response ataupun tidak. If they can tolerate oats, then they can consume it, but we will suggest them, basically sebenarnya paling terbaik, we suggest them to eat gluten free oats, so that is safe for them. Okay. Okay, so if you have other question, you can just WhatsApp me and ask lah. Okay, so that's all. Perhaps we can do further revision masa next lecture lah, so next week we don't have any lecture for NAD 605. Okay, so that's all. Assalamualaikum warahmatullahi wabarakatuh. Thank you, class.